My son does a lot of sport, swimming, rugby and football, so he tends to pick up a lot of verrucas from the changing rooms and showers. They tend to be quite embarrassing for him. He gets a few verrucas and they tend to form into clusters, which makes it very uncomfortable for him.
Verrucas tend to be most common in the age group, in the adolescent age groups, so between 10 and 15 years old. They can affect adults, but the most common age group is between those adolescent years.
So a verruca is a wart, a plantar wart, so on the bottom of the foot. The cause is, as best as we understand it, a human papillomavirus, so it's a viral infection of the skin. Some theories would suggest it lays latent within the skin for many years, and others would believe it's picked up infective agent through often places where there is moisture. So often people associate it to changing areas in gyms, swimming baths and things like this, or at home from siblings and other members of the family.
And it embeds underneath the superficial layers of the skin, eventually causing disruption and accelerated skin turnover at the skin surface. Sometimes when people seek treatment to treat verrucas, they will go to the chemist and ask for available treatments.
Things like salicylic acid are commonly used, trichloroacetic acid, monochloroacetic acid. They can often cause pain, ulceration and many risks associated with lots of those treatments that I've just mentioned. Cryotherapy
is available as well as another option to treat verrucas. That does require quite a bit of patient commitment in terms of treatment interval times. Because of the nature of the action for that particular treatment, it is quite a deep penetrating treatment, and it does quite often result in blistering at the epidermal surface.
The key advantage of silver nitrate is the fact that there is no pain associated with it, and the risks are significantly reduced compared to many of the other treatments. Silver nitrate itself will destroy some of the protein binding of cells first of all and cause a disruption within the chemistry of the cells, and in itself may actually destroy the virus, or at least it will stimulate the normal human response, the immune response that would then deal with the virus, one of the two things.
It has a shallow penetrative effect, so it doesn't cause any cell disruption or destruction on the surface of the skin. It doesn't require any secondary dressing over the top, so it doesn't tend to interfere with any daily activities.
Patient compliance is obviously much easier. We're happier to advise a much larger population of people that they can use this and use it safely themselves.
After the 6 days of treatment, the verruca was still black, but it was healing painlessly and smooth to touch.
Before you start to treat the verruca, use the supplied emery board to gently file away the hard surface layer of cells. The silver nitrate in the pencil tip must first be dissolved in water. We recommend using an upturned glass. Only a single droplet of water is required. Place the end of the applicator tip in the drop of water. Do not press down on the tip, but gently place it in the water droplet. After no more than 60 seconds, enough of the active agent will have dissolved in the water droplet clinging to the applicator tip. Now, gently lift the applicator and place the tip on the verruca. Do not press or rub. The aim is simply to transfer the droplet to the verruca without getting any onto the surrounding skin. Allow the droplet to be absorbed by the verruca and wait for it to dry. Before replacing the cap, dry the applicator tip using a disposable tissue. After 24 hours, use the emery board to file away the dead surface cells and repeat the procedure, being careful not to get any of the silver nitrate solution onto surrounding skin or clothes. Continue to treat the verruca in this way for 6 days and then allow the skin to heal normally. Before repeating the treatment, seek the advice of a pharmacist.
When you're looking at the lesion after you've been treating it for 6 days, you may still see some staining. That would be normal, but you'd be looking to see whether or not there was a smooth area to that where was the lesion, and the skin it just appears to be normal both by touch or vision.
So after 6 days of treatment, the area was still black. It was smooth to touch, but after a couple of weeks I checked again and I was surprised to see that the area was returned back to normal skin. and I was very surprised at how quickly the skin had returned back to normal after the treatment.
Avoca wart and verruca treatment is intended for use on prescription or on a pharmacist's advice. To order the 680 pencil and for pricing information, medical professionals or registered wholesalers in the UK should contact Bray Group Limited by telephone, email or via our website.